In this video, we'll talk about an important syndrome known as Wiskott-Aldrich syndrome. This is a high topic for USMLE step 1. Wiskott-Aldrich syndrome is a rare genetic immunodeficiency that keeps a child's immune system from functioning properly or optimally. This is associated with the mutation in WASP gene. It is also makes it difficult for the child to produce platelets. So abnormally small platelets are found in the child with WASP syndrome. Now it's mostly common in males. When we think about the genetics, Wiskott-Aldrich syndrome shows X-linked recessive pattern of inheritance. Wiskott-Aldrich syndrome is characterized by abnormal immune system function, which leads to actually immunodeficiency. In blood, the IgG and IgM levels are pretty low, whereas IgA and IgE levels are elevated. Eczema or inflammatory skin rash is pretty common in these children. Then reduced ability to form blood clots are pretty evident because the platelets are very small compared to normal patients. So there is a cool mnemonic to remember all the symptoms. It's known as WATER. So W and A stands for Wiskott-Aldrich, T for thrombocytopenia because the platelets are abnormal, E for eczema, and R for recurrent pyogenic infection. Obviously, if you don't have IgM and IgG, there would be recurrent infection with bacteria, right? Now let us talk about the biology behind the WAS syndrome. So the gene WASP encodes for a protein known as WASP, and this is a cytoskeletal regulator. It actually modulates actin branching. It interacts with another protein known as ARP23, which regulates branching of actins. And this branching and cytoskeletal rearrangement of actin is really important for immune cell because they need to move from one place to another place, and that's why their cytoskeletal elements need to be dynamic. They need to squeeze through a narrow pore in the blood vessel. That is why cytoskeletal rearrangement and the capability of this is really important for the immune cells. Especially the immune cell which is affected is the T cell. So T cell activation process is abrogated in this particular symptom. Also, the interleukin 2, which is crucial for T cell, naive T cell proliferation, that is also reduced in this symptom. So when the T cells are non-optimal, it can be categorized as T or B cell disorder. And when the T cell or the cell mediated immunity is not proper, then pyogenic infections are pretty much recurrent. So in terms of diagnosis, peripheral blood smear can give us some idea about the Wiskott-Aldrich syndrome because there would be abnormally small platelets shown here in this diagram. Also, immunological level of IgG, M and all the other antibodies can be possibly checked to understand whether there is Wiskott-Aldrich syndrome is not. The definitive diagnosis is genetic sequencing, but which is costly in nature. Then let's talk about the treatment option. One of the treatment option is hematopoietic pluripotent stem cell transplant. Another option is intravenous immunoglobulin injection on a weekly or like a twice weekly basis. So there is no definitive treatment for this disease, but managing the symptom would help the patient to thrive for longer and improve the lifestyle. But with the improvement of CRISPR-Cas9 and other genome editing technology, who knows that WAS mutation can be treated and repaired. So that's for future. But so far, if you like this video, give it a quick thumbs up. Don't forget to like, share and subscribe. Follow us on Instagram and Facebook. The link is provided in the description. You can support us using Super Thanks. You can pay via PayPal, UPI or Paytm. See you in next video.